the witnesses for all being here today. It's been a long day for you. Appreciate you being here and answering questions. Healthcare has changed drastically in my lifetime. While its great treatments and technologies have vastly improved, the complexity of healthcare has made it nearly impossible for Americans to navigate. I continuously hear how individuals don't feel like they're in the driver's seat when it comes to their own healthcare. They feel that their HR departments choose their plan chooses their doctors, and the patient is entirely left out. The experiment of Obamacare has failed. It is the Unaffordable Care Act, and we see it in real time now. Patients want to be in charge of their health care. They don't want the government or the insurance companies controlling it. They understandably want to be their own decision maker. The pressure is on everyone, on both sides of the aisle and across the industries, to lower the health care costs for all 344 million Americans, not just spend 40, 50 billion a year on just a few, the 4%. Ms. Boudreau, what are you doing to support getting patients back in the driver's seat of the decision-making process, and how are you as CEO involved in improving beneficiary satisfaction and engagement?
Thank you for the question. As I shared, we have two priorities. One, to reduce the cost of healthcare and make the system simpler for everyone. For patients, we have dedicated a significant amount of resources around simplification, transparency, and really just common language so they can understand what they're getting, their programs. We've also invested significantly in technology to assist patients in making decisions and understanding their coverage and going on to our systems. Equally, we think it's important to invest with care providers so that we can share data to make real-time decisions, to make it simpler for patients to take them out of the middle. And so those are all commitments that we think are important. And finally, I would say, really focused on prevention and health and paying for value so that we are focused on outcomes, not just activity.
I want to highlight a particular story from a constituent back in Oklahoma. She's self-employed and has had the same goal-level PPO plan since 2019. In 2021, she saw her neurologist in Oklahoma and was advised to go to the Mayo Clinic in Minnesota. She went to Mayo, got her tests, saw a multitude of specialists, and was diagnosed with MS at 35 years old. And while that was hard news to hear, her health insurance covered nearly all of the services she received at the Mayo Clinic, so she wasn't hit with a huge hospital bill. 2 years later, she had new symptoms, as once again was advised to go to the Mayo Clinic. This time, she was hit with nearly a $10,000 bill. Turns out, her goal-level PPO plan was no longer covering out-of-state services, even if the services were not easy to come by in her home state. The next year, she saw her premiums increase nearly 60%. She, like many others, are now paying more for less. And it's not just the marketplace. Americans on employer-sponsored plans are experiencing the same exact thing. I think it's fair to say, with the massive amounts of federal tax dollars insurers collect, that you bear some of the responsibility to fix the healthcare affordability issue in this country. You all are very talented CEOs. You get paid well. You have great companies. We all got to be in this together. While it's input cost, we all understand how the insurance markets works, whether it's auto insurance, home insurance, life insurance, health insurance. We all have to work together to address all costs. Mr. Cordani, I understand that input costs are rising, but the American people are fed up with the rising premiums and out-of-pocket premium costs, or pocket costs. As the insurer, what is your answer to the Americans that are in the room and those who are watching and those who will watch this for a long time, both today's hearing in here and in Energy and Commerce this morning, that they believe that they're paying too much for far too little?
Thank you for the question, sir. First, we believe there's an affordability crisis, and it starts with the cost crisis we've been talking about. For the American people to get the best possible health care, we need to make it easier for individuals to actively manage their health with their physicians and stay healthy or lower their health risk in the first place. There are many bright spots around that in the employer-sponsored marketplace, and harnessing technology and bringing more personalization is mission critical relative to that. On the other side, if one is dealing with a chronic illness, helping individuals have total access to the medications that are life-sustaining at low or no cost are mission critical. And then lastly, determining whether or not an individual wants to be self-navigated in the healthcare system or physician-navigated. If you want to be self-navigated, supporting them with the tools to make decisions and then supporting them with a physician. If you want to be physician-navigated, actively paying the physician on clinical outcomes in support of those individuals. We find that the best outcomes for Americans happen when we are able to harness each one of those 3 initiatives. When we don't, we have more variability. We have people in a healthy at-risk status that end up in a chronic or an acute situation. When we harness those, we get better outcomes for the benefit of Americans and lower or more sustained costs.
Mr. Chairman, thank you so much, and I yield back.